TOS.
So now we'll do the TOS ones. So first, we're always going to clear with Allen's test because in order for these tests to be reliable, we need to make sure that they have good blood flow into the hand. So this is a skill that you want to practice because you're going to be occluding both the radial and the ulnar artery, and your hands are going to be in a bit of an awkward position so that when you bring, you have to practice, so that when you bring the hand down, then it's going to be in the correct position for you. Okay. So if it's her right hand, I'm going to take my left hand and occlude the radial artery, and I'm going to take my right hand and occlude her ulnar artery so that you can just bring it down. So occlude the artery, have the patient make a fist, and then squeeze, 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 squeeze. Okay, hold the fist, bring it down, open your hand, and then one side at a time, you'll keep one of the arteries occluded, and you'll note how fast it takes for her to regain blood flow to her hand. Okay, great. And now squeeze, squeeze, squeeze. Okay, close. Open your hand, and then you'll release the opposite artery. So Carol has good blood flow through both. We would then test the other hand as well. So then you can move into your TOS test. So the first one is Adson's. So this is for the anterior scalene. You're going to have the arm out to neutral. You'll find the radial pulse. You'll have the patient turn their head towards you and then slightly extend their head. And then you're going to take a deep breath and you're going to hold for 10 seconds. So you're timing this test out to make sure that they're holding for 10 seconds, and you're looking for a change in the amplitude of their pulse. So you can breathe there. We're not really asking for pain or anything like that, and the actual beats per minute might not change, but the actual amplitude of the pulse will change if this test is positive. For this testing scenario, you can test both Adson's and Halstead's on the same side and then move to the other side to save some time. So with Halstead's, that's for the middle scalene. And then the head will go away. So same thing, arm in neutral, find the brachial pulse, extend, so turn the head away and then slightly back, take a deep breath, hold for 10 seconds. Okay, and relax. So then you would then do the other side, Adson's and Halstead's. With Eden's, you're going to do both pulses at the same time. So you're going to instruct your patient to bring their shoulders up, back, and down. You're going to find the radial pulse on both sides.
Keep their arms about at midline.
Mm-hmm. And then you're going to instruct them to hold their breath and then bring their chin to their chest. So again, we're holding for 10 seconds. Go ahead. Okay, and you can breathe. And then the last test is hyperabduction. So for this test, you'll bring the arm up slightly above the head. You can open your hand like, yeah, there you go. However you want to hold their wrist. And then for this one, there is no breath hold. So we will just hold it here for 10 seconds.
In all of these TOS orthos, you want to also ask if there's any reproduction of symptoms, like the tingling or numbness.
Because that's the reason that in clinic and in your practice, you'll be doing these tests because they would have already reported numbness or tingling into their hands.
Yep.
All right. Okay. So then the last part of the TOS test set is called Ruse. So for Ruse, we're going to have the arms at 90 degrees. And it's important, so for the full 3 minutes of this test, that your patient keeps their arms at this. So if you see them starting to drag, you're going to ask them to move their arms back up, and you're going to try and constantly keep them here. So they're going to be opening and closing their hands for a full 3 minutes, so you want to take a note of that. And then during this time is when you can go through the neck disability index. So that'll be on the back of your cervical form. So you can either read them to your patient or hold the clipboard for them. They can read through and you're going to ask them to give you a number. So Carol for this first one, and then circle all the way through. So you can do that and you're still timing through for the full 3 minutes of the test.
And you could do the scoring and you could sign your name all during the 3 minutes.
Yeah. This is a good time too to make sure that you have the patient's name, file number, and date on the top of all of your forms, if you haven't already done so. And it's a good thing to just kind of look ahead to plan what you're going to do next. Like, it gives you a little bit of a chance to have a breather as well. Okay.
All right.